Hey guys, Dr. Z here, specialist in functional medicine, showing you how to rebuild your body and your mind. Everyone experiences anxiety from time to time. This is normal. Anxiety turns into a disorder when anxiety and its sensations and symptoms interfere with your normal lifestyle. Basically, anxiety is a state of apprehension, uncertainty, and fear resulting from the anticipation of a real or unrealistic threatening situation that can lead to impaired psychological and physical functioning. In this video, I will discuss the areas of the brain responsible for creating your anxiety and the physical reactions that are set off by these areas of the brain. I will also provide you with tools to help minimize anxiety and a natural, non-addictive alternative to calm those anxious nerves. Anxiety is on the rise with people, at least what I see in my clinic. Stressed out teens, young adults, and people in general are riddled with fears and anxiety. I don't know, perhaps it's more sedentary behavior because of technology, or unhealthful food sources and the burden of toxins we're all exposed to. And what about overbearing parents who project their issues onto their kids and those who push their kids to be an overachiever? Whatever the reason, anxiety disorders are characterized by excessive and unrealistic worry about everyday tasks or events, or may be specific to certain objects or rituals. Now, the cause of anxiety is not just a single faulty wire. Social anxiety, obsessive-compulsive disorder, post-traumatic stress disorder, and the others have multiple causative factors involving both physical and psychological causes. Some of the biological causes include genetics and abnormal neurotransmitter function and alterations in brain circuitry. Psychological causes include specific conditioning, like being raised with fear, and let's not forget the onslaught of social stressors. This said, research is pointing to different areas of the brain and the actions of 4 neurotransmitters that are implicated in this excessive worry and anxiety and the physical reaction that anxiety causes. I'll now show you these areas. There are 2 main areas of the brain associated with anxiety, the anterior cingulate and the amygdala. Now, the anterior cingulate is involved with emotional regulation and the physiological reactions associated with anxiety. Research is showing that those with anxiety disorders have decreased brain volume of the anterior cingulate that is seen in worry, fear, and anxiety. Now, the amygdala is the starting point for your fear and anxiety reactions. It's responsible for detecting and responding to threats. It drives the fight or flight response with its ensuing release of adrenaline and cortisol, and it's involved in memory storage of emotional events. Anxiety is also due to hyperactivity in the amygdala and an inability of the other higher areas of the brain to calm down the hyperactivity of this region of the amygdala. Ironically, unlike animals who use their fight or flight response in times of immediate danger, we humans trigger the stress response when there is no immediate danger. We can think ourselves into anxiety. That puts us into a state of fight or flight. In addition to faulty circuitry, there are basically 4 neurotransmitters and their receptors that are implicated in anxiety disorders. The 4 neurotransmitters include GABA, serotonin, norepinephrine, and glutamate. GABA is the brain's major inhibitory neurotransmitter. Its job is to calm the brain, slow down nerve function, and relax you. Insufficient levels of GABA results in nervousness, anxiety, and panic disorders. Serotonin, also known as the feel-good neurotransmitter, is responsible for balancing our mood and creating happiness. Now, a deficiency in serotonin leads to depression and anxiety. Norepinephrine is a neurotransmitter and a hormone that is involved in the fight or flight response. Basically, under times of stress or a perceived threat, norepinephrine is dumped into the bloodstream to mobilize the body and the brain for action. In excess, it too can create symptoms and feelings of anxiety.
And last, glutamate is the nervous system's major excitatory neurotransmitter. It's the brain's major driver. It stimulates your brain cells so you can talk, think, and process information. When there is an excess of glutamate, it can become an excitotoxin, meaning it can overstimulate brain cells and nerves and result in neurological inflammation and cell death. Okay, so why is all this important? Because a deficiency of serotonin, GABA, or both, and an elevation of glutamate will act on the amygdala and the anterior cingulate and create fear, worry, and anxiety. And to summarize, anxiety can be caused by changes in brain circuitry, abnormal levels of neurotransmitters, and of course, stored memories that get triggered, causing the physical reactions and sensations of anxiety. And now, here's an illustration to sum up how we create anxiety and the heightened fight or flight response.
With a perceived threat, the amygdala activates the hypothalamus talks to the pituitary sends a message to the adrenal glands. The adrenals then spit out adrenaline, norepinephrine, and cortisol. Now, elevated cortisol, epinephrine, and norepinephrine cause the symptoms associated with anxiety like a racing heart, shortness of breath, nervous stomach, and the feelings like you're going crazy. The diagnosis of anxiety is typically made from a questionnaire or through the evaluation of a therapist based on your symptoms. Sometimes a physical exam is performed to rule out other health issues that may be causing your symptoms. Physical issues that mimic anxiety include heart disease, hyperthyroidism, adrenal gland dysfunction, menopause, and certainly side effects from prescribed medications and substance abuse or withdrawal. Now, following the diagnosis of anxiety, pharmaceuticals, or what I call mind meds, are prescribed. These include antidepressants and benzodiazepines, or anti-anxiety medications. And as you know, there are side effects with all medications, and some of the side effects of antidepressants and anxiety drugs are dizziness, weakness, drowsiness and confusion, depression, constipation, sleep impairment, increased appetite and weight gain, a loss of sexual desire, dry mouth, and blurred vision. Again, this is not an inclusive list. This is just a small list of the side effects typically associated with anxiolytics and antidepressants. Now, I would be remiss to not mention several non-drug therapies that you can use to help relieve symptoms of your anxiety. There's cognitive behavioral therapy, which teaches you how to recognize and change thought patterns and behaviors that may trigger panic and anxiety. The concept behind CBT is to reduce anxious thoughts and anxiety by eliminating your beliefs. Now, psychotherapy is aimed at the resolution of stress and conflicts through talk therapy. In this setting, the therapist teaches the patient how to cope with their anxiety. And last, there's guided active breathing, which is a new method of what I call emotional retraining that has emerged. It combines personal coaching with guided breathing. The method involves a skilled professional who gives breathing instructions, which involve you actively, while helping you process the hidden emotions or memories. Regarding guided active breathing, I've personally witnessed incredible changes with those suffering from anxiety disorders by this emotional physical therapy. For more information on guided active breathing, I suggest you go to the website beinbliss.com. Again, that's beinbliss.com.
In addition to these therapies, there are 5 actions you should take to help reduce symptoms of anxiety. Eliminate inflammatory foods. What you eat has a major impact on how your brain functions, and a poor diet can lead to anxiety, moodiness, fatigue, and abnormal blood sugar levels. The 3 biggest inflammatory foods to get rid of are bread and grains containing gluten, dairy, and refined sugar. Now, eat a well-balanced diet, and you may ask, well, what is that? A well-balanced diet consists of low-calorie, nutrient-dense foods that you eat throughout the day. These foods include plant-based foods, healthful proteins, and healthful fats. These foods also contain magnesium, calcium, B vitamins, omega-3 essential fatty acids, which are all needed to produce neurotransmitters. Limit your caffeine and alcohol. I know this will be a difficult one, but limit your alcohol intake to 1 to 3 drinks per week and try not to have more than 1 cup of coffee or black tea a day. Get moving. Regular exercise reduces systemic inflammation and regulates your blood sugar. Exercising also improves energy and eases stress. Consider Tai Chi and yoga, as these exercises promote relaxation. And last, get 7 to 8 hours of sleep. A lack of sleep can amplify anxiety, and sleep deprivation, which is less than 6 hours of sleep a night, can increase internal inflammation, which can decrease your levels of neurotransmitters, worsen your anxiety and your anxious thoughts and feelings. To summarize, anxiety and panic occur when environmental or emotional stressors convince your amygdala that you are threatened and in danger. The amygdala then activates the other parts of the brain, which sets off the fight or flight response in your body. While the amygdala plays a fundamental role in causing you to panic, it is not the sole cause of your anxiety. Your life experiences create the memories that the amygdala may react to with panic. Alterations in brain circuitry and misdirected neurotransmitter levels and function also contribute to your anxious moments. The pharmaceutical treatment of anxiety is the use of antidepressants and anti-anxiety drugs or benzodiazepines. These drugs are effective at treating your symptoms, however, they come with countless side effects. Now, if you're looking for non-drug therapies, consider guided active breathing, cognitive behavioral therapy, and psychotherapy, which can all help reprogram your brain to lessen your anxiety and your symptoms. I do want to mention an effective, non-addictive product called Tranquil by Victory Nutraceuticals that is now available to help calm those anxious nerves. And I have to say, this product has worked wonders for many of my patients who suffer some form of anxiety. Tranquil is a potent blend of nutrients, neurotransmitters, and botanical extracts designed to promote mental relaxation and mental calm. It is beneficial for those who experience occasional anxiety or are easily frustrated or agitated. For more information and to order your bottle of Tranquil, go to my online store found at drzembroski.com. With this information, I'm positive you can start to overcome those moments of anxiety and finally feel more relaxed. I hope this helps to rebuild your body and your mind. We'll see you next time.